And the next speaker we have is Dr. J.J. Agrawal. He is the Vice President of Bihar Ophthalmical Society. He'll be talking on IOL power calculation tip. He'll be giving us tips on IOL power calculation.
Thanks, my good friend Dr. Pranav has given me the chances for this session. My topic is the IOL power calculation. The major factor affecting the IOL power calculation, as you all know, that is the corneal curvature measurement, and the central topography, axial length measurement, ACD, and the personalized a constant and prediction effective limb position, and the dry eye. We have long journey from ultrasound to source biometry. Now the standard biometry is the non-contact method. Optical biometry is the choice, but we have also alternative, that is immersion ultrasound and base scan biometry if it is necessary. Now optical biometry gives the most accurate reading, most easy to get and easy available to us, and almost accurately reproducible. So it is our first choice. My choice is I have with IOL Master 700. It gives the characterometric rating with two sides, that is telecharacterometric measurement with for the anterior corneal surface and surface for OCTI technology, direct measure the posterior corneal surface. Combining these, we get the total characterometry. This interface of IOL Master 700 giving the anterior and posterior and total characterometric reading. We have also with central 0.3 millimeter zone of the central corneal topography also gives some idea about the corneal curvature. Now there is another thing that has been given in this machine is the CWC, that is angle kappa, that is Chang varying cost. It is it is a angle between the visual axis and the center of pupil. It is important because we have usually we use some diffractive rings, IOLs with diffractive rings, like trifocal, bifocal, multifocal, and some extended depth IOL. We want to place the IOL diffractive rings in concentric, to be concentric with the central and patient's visual axis, so as to the center of the pupil is as influence performance of the diffractive ring. Ideally, we give the best visual performance and the best satisfaction to the patient if the his value is low. So at this point, I want to convey you that CWC reading is should be below 0.6 millimeter. Otherwise, you will get the distorted images. So I will prefer with 0.3 to 0.4 millimeter. But the limitation of optical biometry are the mature dense cataract, fixation difficulty, tremor, nystagmus, and there at this situation we go for the immersion methods. It is the ultrasound method, but it is a non-contact. So most accurate, the no corneal decompression, but the method is through which optical was calibrated in this development. But there is a difference between the measurement of the axial length. In the A scan by ultrasound, we go up to the foveal cup, but for the biometry, optical biometry, we go for the retinal pigmentary layer. So difference is 150 micron. But now come to the recent IOL calculation formula for accurate result. We have Olesen formula, Keynes formula, Barrett Universal 2, Hales RBF, and Ladder Super. These are the newer formula. I am not going to for the other older regression formula. Now just only one line, that is Olesen formula. Here is the C constant, and it eliminates the relation to the E expected length position with K axial length and white to white. So it is better as it is eliminates the relation with the expected lens position. And next is the Keynes formula. It is artificial intelligence with the theoretical optics. Here we have three variables, and it accurately measures all the range of axial length, smallest absolute error for the long eye. So it is very accurate, gives the accurate result in almost all situations, and it is better than other formulas. We claim to be the most accurate than other, but needs cohort study and validation. This is the publishers for the Keynes formula, but it needs validation, no doubt. Now, we generally use Barrett Universal 2. It is a theoretical model. It eliminates the,
49.
estimates the expected rates based on the anterior chamber depth and lens factors. And 5 variables are there. It addresses the different IOL shape and offers adjustment required for the low and high IOL powers. Hill RBF, it is it is artificial intelligence based formula. When we upload the data of the patient, Hill RBF finds the distinct pattern in the apparently random cloud of data points already created by the large number of cases. So that is the pattern recognition based on the artificial intelligence. Artificial based Hill RBF form method is a pure data-driven IOL calculation approach, and therefore it is free from the limitation of lens position estimation, and free from the limitation of inherent of standard formula. So it gives the 2 types of result. Inbound, prediction is very good, but outbound does not only gives does not matches the what is given in the inside the software. So even it is though it is out of bound, but it is good. It is an interface of the Hill RBF calculator. Now, LADA super formula, it works on the based on the sweet spot. Sweet spots are the maximum correct spot responses for a given amount of input. So here we can create the Hill LADA super surfaces. It based on the 4 formulas: Hopper Q, Holiday 1 with Wang-Koch axial length adjustment, and Haggis. Now it is the interface of LADA super formula. With the inclusion of the 3-dimensional graph as shown in this slide, the surgeon knows instantly that if he is handling the typical or unusual eyes. LADA super, if it compared with the Barrett universal formula, if for the extreme size that is shown in the red areas, LADA super is better than the Barrett's universal formula. Now, if you for the comparison regression formula, there is a beautiful article by Mailer, Holiday, and the Chang. Here, which formula is most accurate in all ranges of axial length? It shows that the Barrett and the Olesan is better, and same thing is for most accurate range for all ranges IOL, and it here again the Barrett's and Olesan is better. Now, which formula is more accurate than eyes with the average all the range of anterior chamber value and the eye and all the anterior chamber depth? Here again, Barrett is better than other. Now, for extremes eye, for Wang-Koch adjustments with the Holiday 1 and Kane's Barrett formula is better. For short of hypermetropic eyes, again, Kane formula and Barrett Hill RBF are better. So, in short, we have Kane's formula, Barrett, and Hill RBF. It is better than any other formula.
Dr. Agrawal,
yes,
the paucity of time.
For these are the for the post-refractive cases. Here, ACRS calculator is better than any other. So, if it is when the biometry in the silicon oil filled eyes, here again we have optical biometer with the one is where we can also get the optical coherent biometry in the silicon oil mode, where we can get the good result. So, conclusion: the perfect biometry is utmost important. That is, swift source of biometry is the instrument of choice. Better to take the reading in dioptric power in a plus rotation, as it is important the incisional management of astigmatism using the coupling effect. It is important to use newer formula like Barrett, EVO, Olesan, Keynes, RBF, LADA super. Formula should be free from the limitation of the lens position estimation because it gives the all problematic results. The Barrett and Barrett universal is the most popular formula, though it is though here the calculation of expected lens position is built and more accurate. Hill RBF, LADAS and CAN are the very good formula, and it is improving over time. Still we are improving to get the better result. Thank you.